Right now, Republicans may be the least of the Democrats' problems when it comes to passing health care reform. Democrats are squaring off against each other in this debate. Of particular concern, how abortion might play into any bill that passes. Let's bring in our senior congressional correspondent, Dana Bash. She's working the story for us. It's a problem even vexing the House Speaker, Nancy Pelosi.
That's right, all Democratic leaders. But the Speaker, talking about her, I was standing outside her office until about midnight on Friday night as she was making the wrenching decision to go against her own convictions and allow an amendment that restricts abortion. She was under so much direct pressure from the Catholic Church and anti-abortion Democrats, she had to, or else the health care bill would have failed. But there is still a lot of confusion over what the abortion amendment that passed would actually do. So we took a closer look.
Jubilation over passing health care in the House.
The bill is passed.
But many of these cheering Democrats are already threatening to block a bill from going to the president's desk unless strict prohibitions on abortion are removed. What are those restrictions? Ask advocates on different sides of the abortion debate and get different answers.
People still have the choice of having abortion coverage if that's what they want, but you can't have federal dollars going to abortion coverage.
It's a very far-reaching amendment that would fundamentally change women's access to getting health insurance that covers all of their reproductive health care.
So, which is it? Let's take a closer look. It would ban abortion coverage in a new government-run health insurance option. Private insurance companies in a new government-regulated exchange would also be prohibited from offering abortion coverage to anyone getting taxpayer money for health care. But private insurers would be allowed to offer separate coverage that includes abortion only to people paying with their own money.
The intent of this amendment was to ensure that no one under health care reform could purchase a plan that included abortion coverage.
Abortion rights advocates argue that in practical terms, insurance companies aren't likely to offer two plans and say even if they did, middle-income women eligible for government assistance probably won't pay for additional abortion coverage with their own money.
How ludicrous is it to think that a woman would ever plan to have an unintended pregnancy and plan to have an abortion?
But anti-abortion activists say if government-assisted health care coverage is expanded, current law restricting abortion coverage must be as well.
This simply extends what current federal policy is. The ultimate objective of the abortion lobby in this whole fight is to define abortion as health care.
Now, most abortion rights advocates do call it part of health care for women, and that's one of the many reasons there is such a deep divide on this issue. Wolf, several female senators are working to try to come up with a compromise to ease the restrictions on abortion that passed the House, but talk to anti-abortion Democrats still in both the House and the Senate. These are Democrats, and they say they won't budge. If that changes, they won't vote for health care.
You spoke to Ben Nelson, the Democratic senator from Nebraska. He says he wants that House language, that anti-abortion language in the Senate bill, or he's not going to support it, right?
He said no matter what else is in this health care bill, this far-reaching health care bill, if the language isn't strictly prohibited when it comes to abortions, his vote is gone. And they need that vote. They need every Democratic vote in the Senate.
The difference between 60 votes and 59 votes is success or failure.
You got it.
Dana, thanks very much.
Thanks,
Meanwhile, a battle is brewing over